The CDC and hospitals, like All Children's Hospital, are putting out a warning tonight. Do not overuse antibiotics. We're taking action for your health with a very good local example of why this is so important. While most moms are preparing lunch, Christine Cato is preparing IV antibiotics from Mackenzie to treat her cystic fibrosis.
It's a genetic disease that affects the lungs and the pancreas.
Over the years, Mackenzie has grown resistant to many of the antibiotics.
We're kind of trying different novel treatments to try to treat her infections, which have been very difficult to treat.
Can this be a life-threatening?
Yes, it can be a life-threatening scenario. So that's why we want to educate the community. Do I have anybody else?
Dr. Berman, a pediatric infectious disease specialist, is using the CDC's Get Smart About Antibiotics Week to spread the word.
The problem we're having is, every time a new antibiotic comes out, bacteria rapidly develop resistance.
The most commonly overused antibiotic is Zithromax. You know this as a Z-Pack. Also, amoxicillin and Omnicef.
A lot of these antibiotics taste good. They're easy to give. They may be once or twice a day, and so it's very convenient to give them to people. But we have to realize that most of these infections are going to be viral infections. Even the common cold. Ear infections, a lot of them can be viral infections as well, too. And even sore throats that kids get all the time, only 1 in 5 of those sore throats are going to require antibiotics.
The CDC notes that about 50% of antibiotics that are prescribed are either not effective or not necessary. And annually, about 2 million people will become infected with a bacteria that is resistant to antibiotics, resulting in about 23,000 deaths. While Mackenzie needs to take daily antibiotics, the doctor says her body's reaction to continued use is a warning for others who don't have to take antibiotics to stay alive.
Walk around with it.
All right, here's another tip from Dr. Berman. When the mucus from the nose changes from clear to yellow or green, that does not necessarily mean a bacterial infection. Mucus changes color during viral infections as well. So ultimately, you need a primary care doctor or a pediatrician to make the determination of viral versus bacterial infection.